So good morning, everyone. We are the group 2. Our topic is classification of periodontal diseases in 2017. So why do we need a new classification system? It is to facilitate an international language for clinical communication. Second, to enable proper diagnosis and prognostication for patient communication and education. Third, to ensure implementation of appropriate treatment. Fourth is to facilitate international population surveys of disease prevalence. And the fifth and last is to enable research into the etiology, pathogenesis, natural history, and treatment strategies. So our overview. So I will be discussing the part 1, periodontal health and gingival health. So periodontal health. According to 2017 World Workshop Periodontal Health defines as simply a state free from inflammatory periodontal disease that allows an individual to function normally and avoid consequences such as mental or physical due to current or past disease. Then clinically, periodontal health is characterized by the absence of bleeding on probing, erythema, edema, patient symptoms and attachment and bone loss. So that is the periodontal health. It tackles about the free from inflammatory periodontal disease. So next, so periodontal health and gingival health. So the first one is the clinical gingival health on an intact periodontium. Meaning a periodontium with no loss of periodontal tissue or no loss of connective tissue or alveolar bone. So here is an example. So my example is the intact. Here is this patient exhibits no clinical signs of gingival inflammation and no previous loss of periodontal tissues. As we can see on the dental radiograph, it does not reveal any changes in either the alveolar bone height or the architecture and morphology of the alveolar bone. So here, so as you can see, it is the set of tooth is clinically gingival health and intact of the periodontium. So the second is the clinical gingival health on a reduced periodontium. This is said to be that a periodontium with pre-existing loss of periodontal tissue, but it is not currently undergoing loss of connective tissue or alveolar bone. So as we can see on the 1-1, on the tooth 1-1, there is a it is a healthy tooth or healthy gums in tooth. And aside from that, we can see that the 1-1 and the 2-1 reduced in the periodontium. It is highly increased here. So the next one is the stable periodontitis patient. So in the clinical signs of periodontal health on the periodontium with a pre-existing loss of connective tissue and alveolar bone, which is attributed to periodontitis, but has been successfully treated and is currently stable. So ito is na-treat na patient. Meron siyang pre-existing loss of connective tissue, but na-treat na siya. So here on the image, it is the presented image is there is the story in 2016. This generalized periodontitis patient underwent non-surgical and surgical periodontal therapy to control the disease. 18 months later, The above photo or this photo was taken to illustrate how healthy her gingiva looks following therapy and meticulous home care. So the dental radiograph as seen reveals loss of alveolar bone height. So for future treatment, ang objectives ng future treatment nito is to maintain the reduced periodontium in a healthy and stable state. And also to prevent the reactivation of the periodontitis. So that's the point of the stable periodontitis patient. So the next one is the non-periodontitis patient. Clinical signs of periodontal health on a periodontium with a pre-existing loss of connective tissue and or loss of alveolar bone which is attributed to non-periodontitis reasons. So as an example, recession of gingival margin that occurs from a history of traumatic tooth brushing or the deliberate removal of alveolar bone that occurs in surgical crown lengthening. So this photo has a story that this is a 50-year-old male patient with a history of excessive, frequent daily toothbrushing, madalas na pagtututbrush. According to him, he brushed 5 to 6 times a day with a hard bristled toothbrush. So, dito, ininote na meron siyang generalized recession of the gingival margin. However, walang evident signs ng clinical inflammation. So, on the dental radiograph, hindi nakita dito any changes of the alveolar bone height or the architecture and morphology of the alveolar bone. So, objectives ng future for future treatment nito is to address the patient's self-care habits and reinforce proper oral hygiene or i-educate yung patient primarily. So, and the next treatment is to periodically monitor the patient's periodontal status to prevent further loss of tissue. So, here is the non-periodontitis patient image. So, lastly, here are my references in my report, link, and a journal. So if you have any questions, you can ask me and I will try to answer your questions. That's all.